Dr. Bindu Balani, thank you again for being with us on ITV Gold. I hope you're doing well today.
Yes, thank you very much for having me again.
Of course, so much is happening with coronavirus, and we really want to bring some awareness and also updates on it. So let's go right into it, doctor. I have some numbers coming in today. We are looking at more than 30 million cases of COVID-19 in this country, with at least 545,000 deaths. My question to you is, how are you observing these numbers currently? And, CDC Director Dr. Walensky said that the cases are increasing in the Northeast and the Upper Midwest. What are your comments on this?
So, since I guess mid-February, we have at about nearly 2,000 patients in our health systems. So it's a pretty significant number, just like what we had in November. So the numbers, there was a slight uptake in the numbers in the last week. This week is slightly bit better. But overall, we were a little concerned that obviously the numbers going up, and especially with the news about the different variants in New York and Northeast area, it's a little concerning at this point.
Right. And doctor, because of these variants, many European nations are going under the lockdown, even though they're trying to vaccinate their people. What will need to happen in this country for us to go into a lockdown with these variants?
I hope it doesn't.
Yeah.
I hope we don't have to do that particular lockdown or that effect of the lockdown. But again, if we see a rise in the number of cases over a period of time, I think that would be something that would cause the concern of the possibilities of a need for lockdown. At the current time, though, we don't see it being in the near future, and I hope that's correct. The vaccination efforts have been phenomenal. So we hope that we are going to be doing this catch up between the vaccination and the variants coming along or the new cases coming along. So hopefully we don't have to go back into the lockdown area.
And when you are looking at these cases, Dr. Balani, my question to you is, who do you think are the biggest contributors right now? And how much did spring break affect this uptick of cases?
It's hard to say. Of course, people are getting a little tired of doing their social distancings, etc. So especially with the spring break, both the ones in the last week as well as the upcoming weeks, I think it's very important that the young kids and the young adults are aware of still the various factors that they need to use to mitigate this particular spread. These are the patients, these are the people who have not yet taken or not yet received their vaccinations because they're obviously the age cutoff has not met there yet. So I think it's still very, very important that we continue to pursue with our, the whole point of social distancing and masking, etc. And the spring break, as you said, people are trying to party and that's not going to be helpful.
Yes. And just looking at that, doctor, there are certain states that are currently loosening restrictions, including ending their mask mandate, as we were just talking about these three key guidelines. Do you think it's a wise decision to do so right now?
Not so right now, not so in the summer, not so in the fall. I don't think we should be letting our guards down at this point, because if we are to be a success in this particular pandemic, I think with the vaccinations on board, but social distancing and masking, etc., needs to continue, both because one, not everybody is going to be vaccinated at all given times, and number two, not every person who gets vaccine may be lucky enough to be in that 95 or 100% rates. So I think we do need to take it with caution. We do need to take these vaccines with a caution. I think the vaccines are fantastic, and I think everybody should step forward and take it. But leaving our social distancing and leaving our masks at home is just going to not be able to catch up that particular deficit that's required to keep this pandemic at bay.
Just to follow up with that, doctor, do you see us wearing masks up until perhaps 2022?
I think so.
Right. Well, as long as we all continue to follow this, just more talking about states and loosening restrictions. New York City, where we all are situated, the mayor, Mr. Bill de Blasio, has said that he wants to end remote working by May 3rd. He wants people to go back into work in person. My question to you is, with the variant spreading and us still not meeting that vaccine, administration to the full capacity, is it wise to open a city like New York City, which was once the epicenter?
I think it all depends. I'm sure that the mayor is getting good information regarding the vaccine rollouts and the ability to vaccine by that particular date that he has set forward. Everything is fluid. Everything is assessed on a day-to-day basis. So we hope that we can go back to some form of normalcy, and hopefully sooner rather than later. But again, I think it's an evolution in process. We just need to kind of wait and see. It's a great deadline, but I'm not sure that it may be as practically feasible.
Yeah, only time will tell. Maybe we'll be vaccinated enough for them to open. That would be such a great news. Let's talk a little bit more about vaccines, doctor. Right now, when you're looking at the vaccination program, which is, they're trying to ramp it up, do you think we are vaccinating at a higher rate and a more effective rate? What do you think is maybe missing still in this whole process?
No, I think the vaccination rate has been phenomenal. And with the help of the National Guards, with the police departments, with the state departments, etc., all working together hand in hand, these mega sites are just fabulous. The number of cases, the number of subjects that have been vaccinated, the number of the population that has been vaccinated has been very, very high numbers. And they continue to rise. And as the days goes on, the efficacy and the flow has been getting better and better. I think getting the vaccines to each and every section that should be getting from 18 and above, actually 16 and above in the case of Pfizer. So 16 and above should be rolled out faster, maybe different time frames, like how we had the Teachers' Day, like maybe some weekends for those who are essential workers who are not able to make it during the day, school days, etc. So having those kind of programs, having mobile units, I've heard about some state departments kind of rolling out on a mobile unit to try and still catch up and do the rehabs and long-term facilities, etc., to be able to revaccinate the people that they would not be able to vaccinate the first time in January or February. So all these catch-up programs that are currently present, I think, will just help in increasing the number of cases to be vaccinated. And of course, having a vaccine which is just a one dose really is very helpful, because now we are able to vaccinate even people coming into the ED and going back home, or patients leaving from the hospital going back home. We're able to vaccinate with the Johnson vaccine at that particular time. So again, people where you may be concerned about their ability to come back for a second vaccine, somebody from the shelter, somebody homeless, all of those people on that population can now be nicely brought into the system of vaccination by getting them the one dose vaccine.
Right.
So
and
everything is working out in the right direction.
Right. And you just mentioned the Johnson & Johnson vaccine, the single dose vaccine. My question to you in regards to that is, doctor, people are worried that the efficacy of Johnson & Johnson is lower than the Pfizer and Moderna vaccines. However, it's just one dose. So the great thing, as you said, is you just have to go only once to get it. How are you looking at all of this? And are you worried about its lower efficacy?
So I want to definitely point out that all of these vaccines that we have today, you really can't compare one to the other. It's not apples to apples related to the type of vaccines that they are. Secondly, also the time and the geography of areas where these vaccines were studied at were different. So you really can't compare one of the mRNA techniques to the viral vector vaccine, which is the Janssen vaccine at this point. The overall efficacy was slightly bit lower in the case of the Johnson vaccine, more so related to the various episodes of cases that occurred in South Africa, where it was one of the bigger vaccine sites of trial sites. So the B135 mutant strain was very common in South Africa, leading to a lower response rates and lower efficacy rates. But I think the most important that led to that overall lower numbers that we see in the 66%, etc. But I think the most important thing that the population should take away from any of these vaccines is they're going to keep you out of the hospital. They're going to keep you out of the deathbed. So in that scenario where the severity of disease and or illness related to severe COVID or death related to severe COVID is 100% efficacy, be it Janssen's vaccine or be it Pfizer or be it Moderna. So it does not matter which vaccine you get. Please take whatever you do, because keeping you out of the hospital, keeping you safe, keeping you alive, keeping you less severe case is the most important thing.
Yeah, we cannot stress the importance of getting whichever vaccine is given to you. You don't even get to make that choice, actually, when it's given to you. Let's talk about the AstraZeneca vaccine, doctor. I have a couple of questions on it. It's showing 76% efficacy. Earlier this week, they had said it was about 79, but they brought it lower. They are saying that it had some outdated data in their information. And European nations have banned it because of this blood clot issue that they have seen in some very rare cases. I'd like to know a little bit more about how this vaccine has been made, and how are you looking at it, and do you think it'll get its approval in the US?
So it is let me start with how it's made. It's a simpler scientific ways of finding out the answers first, right? So it is also a viral vector vaccine. What does that mean? It means that the part that encodes for the spike protein receptor binding site is that particular genetic code is put into a shell of a chimpanzee adenovirus. It's more like that Trojan horse kind of example, if I can give. You're putting in something in another shell and then injecting it into your body. The viral vector vaccines technology has been used in the past, so it's not a new technology for us. And the whole hope, or the science behind it is that your body will see that particular vaccine and be able to mount a response. That particular genetic code, once it gets into your system and your circulation, will then stimulate your body to make T cells and B cells and specific antibodies against that particular spike protein. Given the fact that it's a chimpanzee adenovirus, our body has not seen that particular virus. It does not get affected with that virus. So it should give us a robust response. And because it is not giving you a live COVID virus, it's not giving you any live infection at all. So once you get into the body, you should be able to develop that particular spike protein antibodies. The data from Europe is actually very, very, very hopeful and looks really good regarding the response of severe disease and death-related disease. So I think even that perspective, I think it's at par with what we see. Regarding the 13, 14 cases of the clots that occurred, actually the European Union has gone back and looked at that data, and the data monitoring board, actually the safety board, does not think it's related to the vaccine. They will be closely monitoring it, and I think it will get approved back again into restarting the inoculation processes in Europe. Regarding whether we are going to be getting the EUA, I think once we see the US data also, the phase 3 data, once that comes out, which should be very shortly, it will be all dependent upon that.
Yeah, it is. If it's approved, it's going to be the 4th vaccine, which can truly speed up the process. Doctor, when you're looking at people that are vaccinated, one of my most popular questions these days to ask doctors is, what can we do after we are fully vaccinated? And how important are masks still for people that are vaccinated fully?
So it is going to be very important, regardless of whether you're fully protected and you've passed your 2-week point after the Moderna vaccine, or your 1-week point after your Pfizer vaccine, or the 2-week point after your Johnson's vaccine. So whenever you've reached that point where we think that your immunity is going to be as maximal as it can, even after that point, it's very important to continue to mask, continue to socially distance, continue to wash your hands, be aware of indoor gatherings that you have. I think it will hopefully light up a little bit on our ability to have a small group of indoors with patients who are completely vaccinated amongst yourselves. But I think we still have to be very careful in keeping being aware that we could still have some mutant strains, we could still have some mild or asymptomatic diseases that we can carry, that we can still pass on to somebody else. And that somebody else may not be vaccinated. So maybe actually you may be putting somebody else at risk who may have other conditions, who may fare a much worse scenario than your asymptomatic carrier state. So I think globally, I think civic duty wise, I think altruistic wise, or trying to do your part in getting this particular pandemic down, I think even after the vaccines are done, I think it's important to continue to keep social distancing and masking.
Right, doctor, I feel that the more we're seeing the vaccines come around and the more we see it being administered, the more air travel is also happening. It has hit like record recently with a lot of like flights going on during the pandemic. Do you think that's wise? Do you think perhaps people are traveling because they think they're safe, but they're not?
So I think overall, I don't want to have a negative impact saying that you can't travel. I think it's okay to travel, but I think you need to know where you're going, what your local rates of exposures are, what the local red, orange, green kind of traffic light system you're in regarding the number of cases that you're going to. Be aware of the CDC guidance regarding the variant strains. And then, of course, once you get to a different position, wherever you are, every business, unfortunately, has been affected, right? So the tourism business has actually taken a very strong proponent to be able to follow suit the various CDC recommendations very well. So I think, am I condoning you to not travel? No. Am I telling you not to travel? No. But I think if you have to travel, or if you are traveling for either business or leisure, I think it's important to be well aware of the surroundings more so than not.
Let me ask you, doctor, what is your biggest fear right now when you're looking at all of these developments happening on a daily basis?
Seeing and treating the patients here in the hospital, I think we all are jaded in our view. We always see the worst scenarios. We don't think about the asymptomatic carriers. We think about the people in the ICU, unfortunately, right? So I'm always the negative person in my family. Say, oh, don't do this because you're going to be on the intubation. You're going to be intubated or whatever. So unfortunately, we are all jaded with our views, and it's not. But it's important, right? It's a serious business. It's life and death situation for people who are in the hospital. So I would still want to be a little bit more careful. I think keeping our guards up and portraying this severity of illness score to people who are still hesitant about taking a vaccine or hesitant about continuing with the masking or getting the COVID fatigue or following the rules. I think it's important to let them know that it's still a very serious disease, and you really want this disease to go away once for all. And opening up and doing things that could be high risk and passing small clusters forward, especially with the variants with increased transmissibility, for example, will just lead to more shutdowns down the road, and nobody wants that, right? So if we are ahead of the game, let's just push through the end. And let's not have these simple small outliers trying to make it worse for us.
Right. I have two more questions left here for you, doctor. While you discuss our worries with us, as to what could happen with COVID-19, Dr. Anthony Fauci, who is the leading expert on COVID-19, has said that there will be much more liberal guidelines by 4th of July if U.S. cases drop as more Americans are vaccinated. How liberal should these guidelines be?
I will leave it up to Dr. Fauci to make that recommendations. I think it all depends upon the numbers at that point, right? So if we have 0 case, that'll be awesome. And then we can be all up and about and do nothing, do everything that we want. So I think it just depends upon where our numbers are at that point and how it turns out.
How much percentage of the population needs to be vaccinated before we can go to a sense of normalcy?
So earlier on, we were trying to achieve that 70% rule, right? But that was before we had the variants on board. Now with the variants on board, where there's a possibility of increased transmissibility, we may have to push that bar up even further. So anywhere from 70 to 85%, maybe more the better, is what we're trying to go for.
Wow, that really means a lot of the country has to be vaccinated. It's so important that we do that. My last question to you, Doctor, deals with South Asians at high risk. How important do you think it is for them to get vaccine, and what's your advice to them, because they are more susceptible to the coronavirus as compared to others?
I think there's an increased predisposition of the South Asian community to have other metabolic syndromes, to have diabetes, to have hypertension, to have coronary artery disease, etc. And we do know that in those patients who have other medical conditions are the ones who go on to have progression to severe disease. So you and I both could be having either mild disease or asymptomatic disease, or we could then progress to further. And in those patients who have other medical conditions tend to be the ones who tend to have more severe disease. So I think knowing your medical background and knowing your risk factors for this worsening disease is required. And of course, knowing that you are at higher risk, it's even further required that you step forward and take that vaccine.
Yes, for sure. Well, here's to hoping, Doctor, that more people will get vaccinated, and the next time I speak to you, we have some positive news to share. Thank you for your time here on ITV Gold today.
Thank you very much for having me on again.